Hello everyone, my presentation today is on small bowel imaging in Crohn's disease. My name is Jonathan Cruz and this is for Anatomy 520 Imaging Anatomy. I wanted to begin with a description of Crohn's disease. Crohn's disease is a lifelong chronic inflammatory bowel disorder. It typically is involved with the small bowels and it's diagnosed that way. As shown on the slide here, 80% of patients diagnosed with Crohn's disease are diagnosed with the small bladder. When looking at imaging for Crohn's disease, two imaging modalities are the best modes for doing that. Those are radiographs and CT scans. Some of the signs you'll want to look for as far as Crohn's disease are concerned in normal versus disease state are the wall lining of the small bowels. In particular, you want to look for any thickening or hyperenhancement. You can also see a cobblestone appearance if the condition is further along and not like a beginning Crohn's disease. There are some other symptoms as well that we will not focus on, but mesenteric proliferation, also known as creeping fat, is something that can be seen on a CT scan, and it will enhance the CT images as a definite sign of Crohn's disease. These two images represent normal CT scans of the small bowels at the lower levels of almost entering the pelvic region. You can orient yourself with the coxa as a bony structure as well as the lumbar vertebrae. You can also look at the muscles surrounding the area. In this lower region, you can use the obliques. And in the right image, you can use the gluteus maximus, where they would be depending on how low you are. Using the viscera, you can see the cecum and the descending colon. This lower level, you'll mostly see in the middle ileum. So this is going to be your distal ileum, and you can slightly spot the separations between the different adjacent loops. You may also see stool within the small bowels. On this next slide of images, these are some images taken from Crohn's patients. Here, you can these levels are a little lower, as you can see with orienting yourself that this is kind of center line of the os coxa, and we have the sacrum here. So you have the sacroiliac junction. In the behind the os coxa, you have the gluteus max and medius and minimus even. So you can tell what level you're at with that. And the big key difference between this image and the other is the size. You can see the difference here. You can see the distension of the bowels as well as some of the creeping fat in here. And on this lateral CT on your right, then you can see this large inflammation in the small bowel here. Now, here are some of the references, but I'm also going to attach an addendum, which will use a few other mediums to help you possibly orient yourself with the small bowels.